it's such a pleasure to introduce Dr. Bena Brown, Principal Allied Health Research Fellow in Cancer Care and an advanced speech pathologist at Princess Alexandra Hospital in Brisbane, in Queensland. Well, at least you were until a few moments ago. You've now gone to the Menzies School of Health Research. But how long have you worked prior to that at Princess Alexandra in Brisbane?
I started working here as a new graduate speech pathologist in 2002, so it's been 18 years that I've been here at PA before I moved to Menzies.
And how much time have you spent with patients receiving radiation?
I started in radiation oncology working down here in 2005, so it's been 15 years of my life, which I've enjoyed every second, and during that time I also did my PhD in radiation oncology.
And the nub of what that PhD was about?
It was about looking at how people coped with their treatment in terms of the functional outcomes of head and neck cancer treatment, so their swallowing, their nutrition, quality of life, and patient-reported outcomes between two different types of radiotherapy treatment, so altered fractionation radiotherapy and chemoradiotherapy. And
one thing you've been doing is called Health My Way. What is that, its purpose, and how does it work?
Yeah, My Health My Way is an electronic web-based patient-reported outcome tool. So in cancer research over the last couple of decades, there's been a real push to hear the patient voice and hear the family voice during their cancer treatment, because it adds so much value to the care that we provide. So My Health My Way is a way for patients and their families to connect with their healthcare team. So patients enter their data of how they're experiencing treatment onto an app during treatment, and that directly connects with their healthcare team. So referrals are made to different members of the team based on the information they enter.
If you can describe the waiting area where people are waiting to have their radiation treatment, we've often got family members with us. Where is this capacity to enter information about yourself, and 3 or 4 examples of the sort of questions you're answering?
So there's 2 different ways that people can enter their information. One is on a stand-up podium, so it looks kind of like an ATM machine in our waiting area. So patients and their families can come up to the screen. It's a touch screen. They can enter their data that way in the waiting room of our radiation oncology department. Or alternatively, people get sent out a personalised SMS message to their own device, so they can also complete their data in the comfort of their own home or when they're out and about. It doesn't have to be in the department.
So give me a sense of what sort of things I'm telling you as a patient, whether I'm doing it on the pedestal in the waiting room or on my phone at home.
So you're telling us information about how you're physically experiencing treatment, so any physical side effects you have related to pain or nausea or a whole range of different physical things that are specific to your cancer type. You're also telling us how you're managing at home practically, as well as how you're managing emotionally and how you're getting on with your family members and relationships with other people, as well as your experience of distress and things that might be contributing to that distress.
As you know, Bena, I have an interest in distress because I found the experience of radiation treatment with the mask tough. So if I was filling in the podium in your waiting room while I was waiting to go in, and I said that, you know, while I was in the mask I was sweating and going red and the heart was going fast, what would happen? What would happen after I reported that?
So there is a specific question that relates to mask anxiety on our tool. So people can tell us about their general anxiety, but separate to that, people can explain their experience of mask anxiety. And if your mask anxiety is at a level that is severe enough, then a clinical alert, as soon as you press enter on your data, a clinical alert gets sent directly to our occupational therapist and radiation therapists, and they're aware then from the moment that you enter that data that's what you're experiencing. So automatically a referral would be sent to those health professionals to support you during your treatment.
This is all about how to improve the patient and family experience of radiation. How does this Health My Way system improve the experience for the patient but also the family?
So we have also validated the tool for carers and family members. So there's a separate tool that carers can complete alongside the patient. And it also allows then, if the patient is doing really fine and the carer or the family member is having a hard time supporting their family member, then the health professionals can direct their care to the family or the carer in that instance.
So have you done research on this? Do you have any data on what patients and family are telling you, or the impact, the evidence that this is worth doing?
Absolutely. So we've looked at all of the data that's come out through the My Health My Way tool, and it was previously called Screen It. And we have over 7,000 entry points of people who are reporting their data to us during treatment, and that's resulted in patients receiving the right care at the right time when it suits them and by the right professional. It's resulted in 25% less outpatient appointments needed for patients. So if patients are doing fine and they don't need to see their healthcare team at that time, then we cancel those unnecessary appointments. So it allows people to spend more time doing the things that they want to do rather than being at the hospital.
And Bena, just finally, where did this idea come from? I mean, as a patient, I'm thrilled by it. Where did this idea come from? Because it takes the hit and miss out of whether someone notices you're in trouble.
Absolutely. So I think we conceptualised the idea in 2013, and we had a feeling that we were probably over-servicing some aspects of cancer care. So we were seeing people too much and they didn't need to see us that often, but we were under-servicing other aspects like the psychosocial elements, so the emotional response to having treatment, the distress, the anxiety. So we wanted to find a way that we could understand exactly what was going on for patients and provide the care for those specific things.
What do you say to a clinician who may say, look, our job with radiation therapy is to save lives or to prolong life, or to prepare someone for a safer surgery. And we simply do not have time to engage in psychosocial focus. That's the social worker's job.
I would say that there is great evidence that supports that using electronic patient-reported outcome tools like My Health My Way is actually more effective than some chemotherapy drugs. If a patient-reported outcome tool was a drug, society would be demanding that we use it routinely every day, because there's been increased survival found just by including patient reporting of their own side effects and their own experience of cancer treatment.
Bena Brown, thank you so much. It's such a pleasure to speak to you.
Thank you, Julie.
Well, it gives me great pleasure now to welcome from Princess Alexandra Hospital in Brisbane, Dr. Jodie Nixon, who's Clinical Team Leader, Cancer Services and Lymphedema, Occupational Therapy, and you're also the co-chair of the Princess Alexandra Hospital Wellness Initiative. Thank you for joining us. And what is this Wellness Initiative?
So a group of very motivated clinicians and some consumers started it about 3 years ago. And what we had recognised is we were doing conventional care of our cancer patients pretty well, but when the Clinical Oncology Society of Australia introduced the survivorship guidelines, we felt that we really weren't embedding that wellness concept into our treatment.
What does that mean? Can you explain that you weren't embedding your wellness concept into your treatment?
So patients were coming in and getting the surgery or radiotherapy or chemotherapy that they needed, but we probably weren't really embracing that concept of keeping patients well and active and moving during treatment so that their longer term survivalship would be more successful and they'd be able to do the things that they wanted and needed to do.
Let's talk a little bit more about the Wellness Initiative, and then I want to hear what you're doing in relation to mask anxiety as well. But just staying with the Wellness Initiative, I'm aware that you have hand massage and Delta dogs. I am crazy for dogs, so I'm keen to hear about both. But are they examples of the sort of activities that have flowed from your work?
They are. So at the moment we have been a little bit COVIDized, so some of those programs have had to be put on hold. But we have Delta dogs. They come into our inpatient setting. They usually come about once a week, and Molly is the dog that we're lucky enough to have here. She's a beautiful cavoodle, and it just brings patients such joy, when she jumps on their bed or sits on the chair or the floor with them. Particularly when lots of our patients often have to have extended inpatient stays, so they can't necessarily have access to their own dogs as well. And basically it just has a calming effect for people who are dog lovers. At the moment, the Delta dogs don't actually come into our radiation setting. It is only in the inpatient setting that patients have the Delta dog experience.
What benefits have you seen in inpatient, and are you considering, once COVID allows, extending it to, say, people in the waiting room for radiation?
So, Julie, we have actually explored that. One of our radiation therapists that works here has got a dog that she thinks would be perfect, but there's a lot of logistical challenges with getting animals and pets into waiting room environments in particular. So we've hit a lot of roadblocks with that, but we're a pretty persistent group, so we do have that on our long-term vision. I personally always have thought that you need to have two things in a waiting room. You need a cute gooing baby and a cute puppy dog, and that way you've got most people covered.
More power to your arm. Persist as long as you need to make it happen. But when you talk about a baby or a puppy, what are you really saying about the psychological state of a person waiting for radiation and what we need to try to do about it?
I think it's really scary for people, and most people have never been into a setting like a radiation unit before, and it's not something that's even really that similar to other settings that you may be in. So I think it's just the familiarity and the comfort of having a puppy or something more familiar. Another thing that we do in the setting here is we have knitting and jigsaw puzzles set up in the waiting areas as well, so that people can keep themselves a little bit occupied. And it's really nice to see someone coming in, knitting a few rows of a scarf, putting it down, and then the next day when they come back in, they can take it up and keep going as well.
Fantastic. Now, can you tell us about your initiative in relation to mask anxiety, and perhaps you could just begin explaining what it is and its prevalence for people who've never heard of it before?
Yes. So I've had an interest in mask anxiety for quite a while. I've been working in the radiation unit here for about 13 years, and we involvingly saw how people were really struggling with this. So Bena, who you've just spoke to, convinced me to do a PhD, and that was looking at the distress associated with head and neck cancer along the trajectory of the journey. So one of the phases was looking at the mask anxiety. And what we found is the prevalence here was about 26% of people were quite distressed about having to have the mask. Some of the interesting things that we found is people felt supported by radiation therapy, nursing and occupational therapy around if people were communicated with what was going to happen, and just having that acknowledgement of validation, that was really helpful. But some of the other strategies that patients reported were really useful was having access to music while they were having the treatment in the machines, or developing strategies beforehand around relaxation or distraction techniques that we tailor specifically to that person. So some of the things that we've done in the past is an 18-hole golf course. So you start the distraction by, walking yourself up, teeing off, probably going into the water once or twice or into the sand bunkers, but it's just working out what will work for that particular person. Some patients just count backwards from 40 down, or, it's going to be different for everyone.
And when you're talking about that, you're talking about an inner visualisation, aren't you?
Yes, although sometimes we have recorded ones and then patients can listen to that as well. Again, it just depends on the person and the probably level of experience they bring prior to the treatment.
What have you learnt out of all of this, Jodie? Because you've obviously been a whole journey around the patient experience with the mask. What have you learnt out of it?
I think that often all patients need is just somebody to be a little bit kind, and for anybody treating patients with head and neck cancer, whether it's the radiation therapist, the nurse, or the admin officers, that just remembering that this is a really foreign experience for people. It's like walking into a science fiction movie, and just being a little bit kind and patient can make a really big difference.
It's my impression that in many centres, people sort of wait to see how the person goes.
I think it's really important to talk about it beforehand, because it is something that's so foreign and unexpected. Often even just the process of the fabrication of the mask can be enough to unsettle somebody and make them quite anxious and distressed, whereas if they knew what were to expect and were more settled about it, then that may not set off the distress associated with it. In my experience, you've got two different groups of patients, and I can only speak for adults because I don't have experience with paediatrics. But you have patients who by nature are just a little bit anxious, and anything new will unsettle them. So those people will probably be unsettled and anxious about it, but after the second or third session will settle into it and be more comfortable and able to manage it. Then the second group of people are the people who have a true claustrophobia and have often come with a childhood trauma or a legitimate experience of claustrophobia that will make this experience much more challenging for them.
And when you say a childhood trauma, what sort of thing are you thinking?
Again, everybody's a little bit different. Sadly, a lot of people in childhood have been exposed to abuse of sorts, locked in cupboards. We have had a number of patients who've had really traumatic things that has made the experience very, very difficult for them.
I see. So this is, in a way, what you're doing is a kind of trauma-informed care, isn't it?
Yeah.
But Jodie Nixon, I respect and admire your work immensely, so thank you so much for sharing it with us.
Thanks, Julie.
Well, it's my great pleasure now to welcome our third representative from Princess Alexandra Hospital in Brisbane, Andrew Puffett, who's Senior Radiation Therapist, Patient Education, my favourite thing on earth, in the Radiation Oncology Department at Princess Alexandra. Thanks so much for taking the time to talk to us.
Absolute pleasure.
Look, before I go into some really innovative work you're doing with patient education, I just want to get your thoughts on the internal design of bunkers and how we may be able to decorate them or change them in any way to improve the radiation experience for patients and families, the focus of all of this. Could you just begin by giving us a visual description of how you enter a bunker and what you see as a patient for people who've just never been into a bunker?
So a radiation therapy bunker is quite an intimidating space for someone that hasn't experienced it before. Essentially, it's a concrete maze that you walk into. It's very sterile, very clinical looking. And at the end of that maze, there's this large machine which looks something out of a science fiction movie. So when a patient walks in, if they haven't had that, preemptive view of what that machine is and what that look is, it can be quite unsettling.
And when you say a preemptive view, what do you mean?
So one of the things that I've been working on is to, educate patients about what the equipment is that we use to treat them. As I said, it's quite scientific. It's quite technical, so having to break it down in a way that people can understand I think is very important, because they are lying on a bed each day and this equipment moves around them, and unless they have some sort of understanding in what that equipment is actually doing, it can, give them a sense of anxiety.
And does it make a noise, the machine?
It's very loud, the machine. I've never been in the room obviously when the machine's on, but from what patients tell me and what we can hear even outside, it's kind of like a buzzsaw sound, a high electrical piercing sound.
You were so deeply moved by the challenge that some patients experienced. You created something out in the waiting room of Princess Alexandra Hospital that I've been lucky enough to see. Can you first explain that pedestal, what's there and why you created that, and then we'll move on to how you've developed it?
So it's essentially an information kiosk that we have for radiation therapy patients. And I guess the idea was I wanted to familiarise the patient when they came, before they walked into that room, what they'd experience and what they'd see. And it uses an interactive touch screen. So it gives them a sense of control. So when we show them the linear accelerator or the treatment machine on the screen, they can manipulate all the components that we would as a radiation therapist. So by touching that screen and moving the components, they know, oh, this is what that does. It's not going to hurt me. It's going to take an image of me so the radiation therapist can line me up more accurately to give me that curative treatment.
And you, as part of being inducted as a patient at Princess Alexandra, do you show them this kiosk and explain what it's about?
Yeah, so when they walk in, our nurses or the radiation therapists will essentially stand them in front of the kiosk, and they can swipe through the different slides on the actual program, and some of them will talk about the CT scanning process when they come for planning, and the others will focus on treatment. We also familiarise them with the staff. So we've got a really good allied healthcare program here at the Princess Alexandra Hospital, and it's one of the strengths of our radiation therapy unit because we can give patients that extra care they need. So we let them know those different support groups straight from the get-go, so they know where to seek help.
My memory is that you actually see the pictures of people and like a little bio. You know, it really briefs the patient and the family member on who's who in the zoo, I suppose you'd say.
Yeah, exactly. And all the allied health groups get like a little 30-second advert for themselves to advertise what they do, because when someone comes in, they don't necessarily know what a speech pathologist does for their care. So by letting them know that, when they have issues, they obviously can walk and talk with that person.
Well, just before I go to that, and how does that placement of all that visual information in the waiting room assist the family?
So when a patient's actually having their treatment, we don't normally take them into the bunker to show them all the gear and explain what's going on. So that 10-minute process where they're having their treatment, the family member can wander up to the kiosk and have a look through it and get a sense of what's happening and how we're taking care of the individual.
And how will that help the family member?
From my point of view, I think it's more about, it opens up a door for conversation between the family member and who's having treatment. It gives them the ability to communicate on a similar level using similar terminology, so they can describe the experience and talk about any issues they're having.
And Andrew, you mentioned 10 minutes treatment, but some of us are longer, aren't they? I mean, mine was 20 minutes, so some people can be in there for a while in the bunker.
Yeah, it certainly does vary. On average, we tend to do 10-minute treatments, but it can be anywhere up to 40 minutes depending on the condition of the patient.
So tell me what you've done next, because you've gone on to interactive ebooks, so and to things that you can look at on your phone. So tell us about that.
So what we wanted to do is wanted to give a tool to the clinicians to let the patient walk away and have accurate information that they could read through in the form of an ebook on their mobile device.
And how's it going?
It's early days. So one of the things that we found is that there's that barrier with technology still, but the demographics changing. So the elderly population still are relying on their family members to download the app and install it, things like that. But as that transforms over time, I can see the tool becoming more valuable and more used. So we're running about probably 35 to 40% of usage with our patients at the moment.
And do you have a print version of this material as well? Or would you offer them the Cancer Council booklets?
The Cancer Council booklets are used. We don't offer a print version of the material. My belief is that if someone can't access that material that we've got digital in that digital space, they need that one-on-one chat, that one-on-one care. And I think that's very important not to move away from. You can put pieces of paper in front of everyone and make them read it, but I think if you can have that one-on-one interaction, you'll always have a better outcome with a patient.
And just 2 or 3 of the characteristics of this tool you've created, these interactive ebooks, that you're particularly proud of. I mean, as I understand it, you can direct people to a particular patient pathway. They've got multimedia dimensions. You know, what are the aspects of it that you're proud of?
So we're building multiple modules. So like I said, it's early days yet, but the idea will be that we'll give patients information that's really specific to their particular case. And an example would be, at the moment, we have quite a few Chinese patients that come through, and we've got a section in the app where they just push a button and it translates content about one of our programs, Deep Inspiration Breath Hold, into Mandarin Chinese and they can access that content. And we're doing that for multiple languages. Fortunately, we've got quite a few people in the department that speak a range of languages, and they're spending their time translating for us.
You raise a really important point, because the great value of visual information is, even without the translation of the words, people can gain a lot of information from the pictures.
Yeah, certainly a picture tells a thousand stories, doesn't it? And that's important because we have such a limited time with a patient. If we can get that information through in a way that they can interpret, that doesn't necessarily rely on language, I think we can make good inroads into removing that anxiety from a patient's journey.
Well, look, just finally, part of what we're looking at in this series is how the visual design, the internal visual design, can improve the radiation experience for patients and families. And I've been into a lot of bunkers now since I had cancer, and they vary enormously across Australia and across the world. So some have coloured walls, some have very interesting kind of images with backlighting, that while you're lying on your back you can actually be in a forest or in a fish tank or whatever. Just your personal views about what degree decoration, to make it look less clinical, may assist the patient.
Oh, absolutely. The bunkers are overtly sterile by nature. So if you can have wall art, anything dynamic that's a distraction is always helpful. So you're talking about sky panels there before. Just bringing that outside world into that bunker space makes you automatically feel calmer. Even from a treatment point of view, as a radiation therapist, I prefer to have some natural light feel in that room because I'm in there all day as well. So that helps. Having audio, good quality sound systems, and even just as you walked in, at the moment we've got a wall that's sort of got a big photo print on it of a creek scene, and that provides that calming sensation as well. But having something dynamic on a laser projector on that wall, so it can change the season or change the scene, and it gives that person every day they come in something different to think about.
And the emphasis I'm hearing there is on light, on nature, on colour, and on something that varies. Are they the key elements you're trying to recommend?
Absolutely, yeah. You definitely want that nature feel in there, bringing that outside world into that space.
Andrew, it's just been so fantastic to talk to you, and I just want, on behalf of patients and family, personally thank you for the innovation and passion you've brought to the visual education of patients and family. It's a truly marvellous thing you're doing, so thank you.
Thank you very much, Julie.